Good evening, everybody, and welcome to this Stride workshop, COVID Resilience, Lessons Learned from HIV. Tonight we'll be joined by Richard Weydert-Jacquard. He's a triage specialist nurse with a clinical background in health promotion and patient education nursing. He delivers training to support people to live well with HIV and manage health conditions. And in tonight's talk, he'll be addressing the COVID-19 pandemic and focusing on living well with HIV and how to build upon this in order to bolster our resilience and invest in protective factors. Richard, good evening. Good to have you with us.
Thank you very much, Greg, and thank you so much for that introduction. So as Greg kindly introduced me, I'm Richard Weydert-Jacquard. So a little bit of a background for everyone watching in terms of finding out who I am. I am indeed a clinical nurse, triage specialist for NHS 111. Obviously, it's a national phone line. I'm sure many people have used it before. So I do that part-time, and I also work as a health promotion and education nurse, working with several charities in central London across a wide variety of conditions, but also specifically in sexual health. And I've volunteered actually several years ago. I started volunteering with Positive East, initially running or helping run some of the HIV testing clinics, and also working with Positive East and a number of other sexual health charities in London to deliver peer support groups for people living with HIV. I'm also currently undertaking my master's in public health, which is essentially crowning and gaining more experience and qualification in that area to sort of move further into the realm of public health, which is quite pertinent to tonight's discussion, tonight's presentation, which is obviously around COVID resilience and lessons learned from HIV. So that's a little bit of a blurb and a background on me. What I'm going to do now is I'm going to share my screen. So if you give me 1 minute, I shall bring a lovely presentation. Perfect. So introduction, brief introduction. Just to give a little bit of colour and frame this topic, essentially we're focusing on what we can learn from living well with HIV, applying those skills, tools and approaches we've learned to manage that condition and other chronic conditions to enhance our pandemic resilience. So obviously we've all been living through the pandemic. It's now moving into a year and a half since Britain has been feeling the effects of the pandemic. So essentially we're going to begin with a bit of a look at the road so far. So looking from when COVID first arrived in the UK, or at least we first detected it, all the way through the first and second wave, and now obviously we're now unfortunately in a third wave. And just giving a bit of a context to what we're going to discuss tonight. Then we're going to move on to vaccines, why they're great, and why, if you haven't already had one or second one, it's important to have one. And I'll talk a little bit around the efficacy in vaccines, particularly in light of people living with HIV, which some of our audience might be. And then I'm going to move into something which I think is quite important, which is examining the multitude of feelings, as well as some common feelings that people are experiencing around the pandemic, around lockdowns, around restrictions, around this sort of challenging time that we've all been living through. And I think it's really important that we look at that, because everyone is feeling some similar things and some different things to this. So I've tried to tease that out and pull that out with reference to 3 case studies, looking at 3 different potential scenarios that someone might be living with, and 3 very different sort of responses and reactions to the pandemic. But like the most important thing I want people to take away from this is that there's no right or wrong way to think about the pandemic and to think, to experience it. We'll go on to, after this, talk about investing in protective factors. And I'm going to be making a distinction between factors that you can essentially initiate in your own life, on your own, And then the second one is more of a sort of wider support services around you that you can get in touch with, that if you take advantage of, you'll have, you might well experience a boost in resilience for living through this pandemic that we're all presently living through. Before we conclude, I'll be moving on to my crystal ball mystic meg moment, where I essentially give you my own view of what the road ahead might look like based upon previous waves, the evidence base thus far, and emerging technologies. This is obviously no one can predict entirely where the pandemic is going to go. So it's less of a direct prediction, more of a, these are the factors that might make it better, these are the factors that are unknown. Just so you kind of have that overall awareness. And then we'll obviously conclude, and I will provide a summary of what we have discussed. There'll be a brief pause, and then once we'll then move on to the Q&A. So if you have any questions, I'm very happy to answer them. Maybe jot them down, maybe keep them in mind as I'm talking, and then obviously we have time at the end of the presentation to ask. If it's something, COVID related or HIV related that I can answer, and it's not specifically relevant to anything I've talked about, I'm also very happy to answer those questions. So just have a think, and as much as I can within my remit, I will answer those questions or signpost you to a source that might be able to better answer them. So with that in mind, we move on to the road so far. So if we can all cast our minds back, when I was working in NHS one-on-one before the pandemic, we'd started to hear things about, sort of COVID cases being diagnosed in mainland China round about early December. However, the first cases that were actually officially diagnosed in the UK were in January. I think it was mid-ish to late January 2020. I think we now have some data to indicate that COVID was actually in the UK probably at least a couple of months before that. But in terms of the diagnoses, it was difficult to tease apart. We didn't have a diagnosis test for it at the time. And also it was an emerging condition. And also we're in the middle of, cold and flu season. So it was quite challenging, having not experienced what coronavirus, or COVID-19 rather specifically, was like, to kind of diagnose it before that point. So obviously I'm sure we all remember that sort of that fateful afternoon when the Prime Minister asked, the country, I believe it was 23rd of March, to go into lockdown, something that I think pretty much all of us had never experienced in our life. Quite an unusual thing to do. But obviously, whilst there had been a few months of sort of downplaying, oh, it's not going to hit us, it's going to stay in mainland China, unfortunately, that was not the case. And, we needed to lock down. And that was the first wave that hit us. Obviously, we stayed locked down from 23rd of March and begun very tentatively easing, I believe, in early June. We then did something a bit strange and moved into a kind of an eat out to help situation to sort of boost the economy, which unfortunately, evidence suggests, whatever your thoughts on that scheme or the importance of the scheme, might well have led to a second wave occurring. The second wave, it obviously peaked round about January, again, so almost, a year after the first cases entered the UK, but you could steadily see, those of us who were following it, from September, it was just beginning to grow exponentially. Looking at sort of why it was rising so quickly, obviously we had come out of a lot of the social mitigation measures like lockdown and that sort of thing. But obviously we found that there was a new variant, which used to be called B117 or the Kent variant. Now it has been named the Alpha variant. So if you're reading around it and they talk about Alpha, they're talking about that variant. So that variant was found to be more transmissible and slightly more lethal than the previous variant. So unfortunately, that was one of the reasons behind the second wave. So we had locked down, we'd sort of done a few tiered restrictions, and then we went back into lockdown. And if everyone remembers, Christmas was a bit, are we doing it? Are we not? And then we, as we know, I don't have to tell you this, we only started coming out and easing restrictions, first with school children going back at the end of March, and steadily over the last few months, sort of, easing things. And now we're in a strange situation now. We're in a situation where the science might indicate that actually locking down might be a better thing to do. But there are, some political realities and economic issues that, the government have decided to prioritize, at least for now. And as such, whilst we're effectively in the middle of a third wave, we are, going to have quote unquote Freedom Day in 5 days' time. And obviously the mask mandate and the social distancing mandate will be dropped, so it's no longer a legal requirement to wear a mask. More on that later. Spoiler alert, keep wearing a mask. So cases have been rising exponentially, and as with the previous variant in September, it's partially driven by unlocking, but it's also partially driven, as we know now, by this new variant that is called the Delta variant, which is yet more transmissible than the Alpha variant, and yet more lethal than the Alpha variant. So unfortunately, we have a situation where COVID itself is becoming more and more virulent. The good news is vaccines remain largely very effective, and they have and are being a game changer. So we'll talk about vaccines in a minute, but really important that you consider having one if you haven't already had one, and go back for your second dose when you're called for it. So, COVID has been a very variable pandemic thus far, with lots and ups and downs, and it's driven by just such a wide range of factors. So that's a little bit of a précis. Obviously, we've all lived through it, but it was a bit of a kind of, specific look at, where we've been in the last year and a half. Now, vaccines. So vaccines are great news. Vaccines present, as you can see from the slide, our strongest long-term tool in overcoming the pandemic. They're not the only tool in our arsenal. If you look at them in relation to HIV, let's say vaccines are, it's a very different technology, but let's say vaccines are antiretrovirals. They are the treatment. They're game-changing. However, obviously, practicing safe sex, obviously getting tested, obviously, other interventions such as PrEP, such as utilizing condoms, so many other things in our arsenal we use to kind of mitigate HIV and manage HIV very well. So I have to say vaccines are a great achievement, but without going further too much in the presentation, it might be that we might need to use other methods as well in the fullness of time, such as restrictions returning. And I would definitely recommend, whether restrictions return or not, certainly when cases are high, adhering to mask usage and social distancing where possible. So the vaccines that we currently have in the UK, there's so many vaccines out there, and I'm happy to answer as many questions as I possibly can about vaccines. I've followed the research on all of them, with great interest, professionally and personally. But the three that we're using approved for use by the UK government at the moment, or authorizing body, the MRHA, are the Pfizer vaccine, the Moderna vaccine, and the AstraZeneca vaccine. So the Moderna vaccine and the Pfizer vaccine are what they call mRNA vaccines, so slightly different technology. And the AstraZeneca vaccine is what's called a viral vector vaccine. You don't necessarily need to know the distinction. One is not necessarily better than the other. It's important, whichever one you have, that you continue to have the same one, unless guidance changes in the future, which it might do. So vaccines offer, generally speaking, very effective protection against severe illness and obviously death. We're already seeing that, despite the cases rising in this particular wave with a more lethal, more transmissible variant, even when you compare it to the previous variant, with the intervention of most of the public having had one vaccine, and I think 66% so far having had their second dose. If the link between COVID and death hasn't been fully broken, but it has been watered down massively already. And that's even in the context of not everyone having had their full vaccination as yet. So, vaccines, they offer a lot of protection. When we talk about vaccine effectiveness, it's important that we contextualize this. So you'll hear this a lot, how effective is the vaccine? Initially, when the vaccines came out, we were talking specifically about how effective are they at preventing symptoms. Then we were talking about how effective are they at preventing infection at all, because as you know, 1 in 3 people, even without vaccination, can be infected, carry COVID, transmit it, and have no symptoms themselves. But now we've moved on with these sort of more dangerous variants that keep reproducing to focus on the most important component of vaccination, which is obviously preventing you going to hospital, preventing you going to intensive care, and preventing people from dying. And as such, even against the new, Delta variant, the vaccines remain largely extremely effective in terms of severe illness and death. They're relatively effective at preventing symptoms and preventing infection. But obviously, as we're seeing, despite having so many people vaccinated, the case rate is still climbing at an alarming rate. So in terms of our effectiveness, we're focusing more on how they protect the individual rather than necessarily every aspect of efficacy at the moment. So the evidence around HIV and vaccination is still emerging, but the very good news is that basically all of the vaccines that I've mentioned, Pfizer, Moderna, and AstraZeneca, have included a fairly large sample size of people living with HIV into their trials, and the evidence is overwhelmingly positive. Essentially, almost every single person living with HIV in all of the trials across all of the countries that I've reported thus far have made a really strong immune response when they measured their blood, a month after, 2 months after having had a single dose and then a second dose, which means that HIV in and of itself, as long as it's well controlled, isn't necessarily something that's going to, give you a higher risk factor and or, make the vaccine not work so well. That being said, it's important to understand that, if your CD4 count is low or your viral load very high, the vaccine may not have taken full effect. And so the most important thing to do, or if you have any specific questions regarding your risk factors around HIV or your HIV, if you're living with HIV, is to discuss it with your HIV team. The specialist nurse, the consultant, they are absolutely the best people to speak to regarding this. And they are at the forefront of the research in that particular area as well. But largely speaking, while having any, kind of underlying chronic condition, diabetes, asthma, HIV can increase your risk. Well-controlled HIV seems to ever so slightly marginally increase your risk in comparison to other conditions. So diabetes increases your condition a lot more, obesity increases a lot more, hypertension increases a lot more. But even within those conditions, there's still some really strong evidence emerging saying that the vaccine is highly protective, particularly against hospitalization and death. So it's important to take that with a grain of salt. So moving on, if my slides let me move on. Here we go, apologies for that. So that's the kind of the sciencey bit out of the way. I'm very happy to answer questions on that. So please do ask if you have any. So common feelings around the pandemic. Now, it's just, I'm sure everyone has so many different feelings about this, but, it's important as we just acknowledge that we're all human, we're all going to respond in very different ways and have a very diverse, often conflicting set of feelings around the pandemic. Clinically speaking, in terms of how, people who speak to me as a nurse or, present clinically to me as a patient, I often hear, fear, anxiety, low mood/depression, anger, frustration, exhaustion, restlessness, unfairness, and hypervigilance, which means constantly being aware of sort of, theoretical danger around you. And these are just sort of a few of the common presentations we have at one-on-one, or if I'm running a clinic. So I've certainly felt a lot of those, even as a nurse. I'm sure many of you have felt a few of them too. So what I wanted to do is I wanted to look at 3 different possible scenarios, just to kind of tease out the different things people might be feeling and the conflicting situations people are in. So this is the first of 3. I'll read this slide now. So this is Luke, he's 39. Luke has been on the government shielding list and is himself extremely clinically vulnerable toward COVID. So he's been identified through his medical records as someone who's extremely vulnerable to COVID for a number of conditions that he has. He's spent much of the last year, so more so than most people, in a perpetual state of lockdown. So, those who've been shielded were, essentially shielding away longer than most people. Often GPs and consultants have issued specific advice to people saying, yeah, even though restrictions are easing, you need to stay in, or you need to do this, that, and the other. So he's been in lockdown for, over the last 18 months, let's say 14 of those months. His GP has advised him to take care even as restrictions are easing. What might Luke be feeling? So these are just some of the things I've come up with, but we can talk about this case in the Q&A if we need to. But I think he might be afraid that he'll contract COVID and either end up seriously ill in hospital or maybe even pass away. There's that real fear, particularly for people who are extremely clinically vulnerable. He hasn't gotten to spend much time outdoors, so he spends most of his time cooped up indoors. And while he might miss socializing, the prospect of socializing and re-entering society might fill him with a large amount of anxiety or even dread. He might feel angry with those who have previously been flouting restrictions, feeling they might be elongating the pandemic, making it unsafe for him and others to go out. Certainly, in the current context, with COVID rising massively and the government abandoning all restrictions, he might feel concerned that, he'll never get out, that it'll become a 2-tier kind of society. And all of this, other than increasing his anxiety, might contribute quite possibly to a low in mood state, or feeling sad, feeling very low, depression. So let's hold Luke in mind and put him to the side for 1 second. We move on to someone in a very different situation. Right, so case study 2, a lady called Jamila. Jamila's 49. She's a single mom of 2 primary age school children. She has been working full-time as an administrator in an office, but obviously up until now, as largely people, a lot of people in the office have spent a lot of the last sort of 18 months fluctuating, but mostly working from home in many areas. She's been working from home. She might be feeling anxious for her children's safety as they've now returned to school, and so she sees that cases are rising quite quickly in primary school children, and she keeps a close eye every day on the numbers in her area. She Googles COVID in my area, puts in her postcode, and finds out, what the rates are in her particular area and where the school is. And she tries to balance the risk that, exposing, her children might be exposed to COVID with the massive need for her children to be educated, and this is something that we've seen a lot. Obviously, children need an education, they need socialization. That being said, there's a global pandemic on. How do we balance that? She's concerned her children spend a long time not in school. They've been doing some e-learning, but it's perhaps not as effective as she'd hoped. And she's worried that this might have a real impact on their education, therefore their life chances sort of going forward in life. She's grateful that, unlike quite a few others, who might have been made redundant or fallen off after furlough, she still has a job. She prefers to work from home though, as she can manage her time more effectively that way. There's no long commute. And crucially, she can spend some more time with her children, something that she's actually really enjoyed doing in the last year and a half, sort of spending more time working from home. However, the office have said, right, the Prime Minister said we can all go back, abandon all caution, we need you back. So she's quite reluctant to go back because she doesn't want to miss her children, it's inefficient. And, you know, there's this in the back of her mind, will she infect her children with COVID if she goes to an office environment? So obviously, she's going to be feeling a number of things, chiefly among them perhaps anxiety, not knowing what the best course of action is, having to strike some sort of balance that's going to be uncomfortable for her. So next case study, Owen is in a very different situation again. Owen is 26, he's a single gay man living in a big city. He works as a self-employed fitness instructor. So he may be experiencing significant financial issues as a freelancer. There was no opportunity for him to be furloughed. So obviously a lot of people who are freelance could have accessed a certain degree of support, but often less than those who are substantively employed and the government would furlough during the lockdowns we've had. He received some small help from the government, but is concerned that a new wave of infections might mean restrictions need to be reimposed. And obviously gyms are often one of the first to close and last to reopen. And his primary source of business is exercising with clients and working with clients in a gym-based setting. So this is presenting and has presented massive financial challenges for him. He has stuck to all the restrictions and has also had his first vaccine, which is great. But he's frustrated that despite the vaccine rollout, the government have taken their time to release, or relative amount of time to release restrictions. He absolutely loves international travel, and obviously most countries are still on either the red or the amber list, and he's not been able to travel for an incredibly long time. So he's had financial difficulty, and the one thing he really loves the most, he's not been able to do. He feels angry. He feels he's losing out on his golden youth. You know, he's only 26 years old. While he understands the need to protect the most vulnerable in society, he wishes to kind of go out and meet people. He wants a romantic partner. He wants to have fun. He wants to sort of develop in that way. And he's felt that because of lockdown and the pandemic, it's been really difficult, pretty much impossible to do a lot of those things in the last year. He's now starting to feel not only financial anxiety, but a real sense of intense isolation. He feels really separated from society, from his friends, from the idea of developing a relationship. So those are 3 different case studies. From those 3 case studies, they're all obviously very different reactions to the pandemic. This is going to be a rhetorical question, but those of you who are there, you can obviously answer in the Q&A, and those of you who are going to be watching this later at home, ask yourself, how do you feel now? Is it different than when the pandemic first started? Has it changed? Do you empathize with any one of these people, with Luke, with Jamila, or with Owen? Any of these 3 scenarios kind of striking a chord for you? Did you find something sort of unexpected came up for you? Did you think that, you know, most people were feeling one particular way, or did you think that there was, you know, going to be quite radically different views on things? That's just a bit of a thought exercise sort of for yourself. It's certainly something that I kind of had to, you know, really push myself on. I come from a clinical background, and I'm also myself quite high risk to COVID. So I had to sort of go, what about someone in a different situation? What about someone with kids? What about someone whose business relies upon something else? What about someone who, you know, who wants a relationship, isn't in a relationship? We're all so very different, which is great, but unfortunately it means that we're all going to have different views on, you know, on the pandemic thus far. So moving on from that, I really want to talk about protective factors. Now, I'm not sure if anyone's heard of the term protective factor bandied around, either in regard to HIV, another health condition, or mental health in general. But so protective factors, we're going to be talking specifically about behaviors you engage in, either initially sort of on your own or with wider society, friends, family, social groups, and support services, such as the NHS, such as Positive East, that when you engage in those behaviours, they give you a boost mentally and they protect you against low mood, depression, anxiety, and they enhance what we call resilience. So essentially the ability to cope or manage it with a situation by utilizing a range of strategies. So these are essentially protective factors. So before we sort of move on to them, the two kind of tips I want to impart you guys, if you don't already do them, are number one, and this is something I've really had to do myself, limit COVID time. So by which I mean, it's important to stay informed. However, you know, it's very easy, particularly with the way the 24-hour news cycle reports and the fact that negative news, you know, sells, whereas positive news often doesn't, to fall into a bit of an obsession with COVID. I personally, myself, despite having to stay very informed because I'm a clinician, have had to limit my time. So in the beginning, you know, I used to check the figures, you know, all throughout the day. I used to constantly do a lot of research. I do research now to build upon my knowledge and also for my master's. But even outside of that professional aspect, I make sure that I personally see what the figures are every day. Sometimes I'll miss a day and I limit it to about sort of 20 minutes at the end of the day. Because one of the things it's important to recognize is this is not a sprint. This is a marathon. You know, obviously we've been living through it for almost a year and a half. I don't think COVID is going to disappear overnight. So I think we need to keep, as we would be running a marathon, keep well and not sort of, you know, spend too much time just looking at that one subject, and go in sort of mindfully and intentionally in terms of, I'm accessing this information because I want to know this, and then not letting it kind of, you know, take up a whole day. And then the second thing is consider the source. This is super important. I mean, there are those of us sort of, you know, who may be kind of, you know, researching it more clinically, looking at journal articles and looking at the Lancet and New England Journal of Medicine and various other things. But it's really important not to be swayed into thinking, you know, this has been reported in some, you know, rag magazine, therefore it must be true. So consider your source, really important. So bear with me 2 seconds. So self-care. I'm sure we're all sort of quite familiar with this concept. So essentially, this is one of the largest areas of investing in protective factors. So when we look at self-care, we want to look at it in quite a holistic way. It's not just one activity we do. So let's look at it dietetically. So in terms of your diet, making yourself a nutritious meal. One of the things I loved about volunteering with Positive East, other than meeting lots of people, was the food was always amazing. I'm sure it still is, you know, where it's possible to meet face to face. But, you know, it's quite easy to reach for a chocolate bar or order McDonald's. And obviously once in a while, you know, we all need a treat. But in, you know, a lot of evidence, particularly around mental health, has shown that having a nutritious, balanced meal is just so fantastic in terms of micronutrients for your mental health, in terms of stabilizing your blood sugar, and it has massive impact upon your immune system, upon, you know, how much you sleep, which is another thing we need to talk about. As well as managing risk factors for COVID. You know, obviously maintaining a healthy weight, if we are overweight, potentially looking at losing weight, can massively reduce the risk factors for adverse reactions with COVID, massively. So, you know, people have often also said that, you know, when you prepare a nutritious meal, and it's not just, you know, bunging it in the microwave 5 seconds, there's kind of a therapeutic process there. So you're sort of slowly kind of preparing the food. There's a lot of tactility there. It's quite a central process. Obviously, if you live with people, you know, or, you know, you have a partner or family or friends that you're cooking with, it can be just, such a bonding social activity to prepare a meal together. Exercise. So there is almost no study out there that talks about exercise and mental health that doesn't paint it. The results don't paint a very positive picture. So, obviously it used to be that we could only go out for once or twice a day for exercise. And in subsequent lockdowns, we learned that it's actually more important for mental health as well as physical health, that people get out, more unrestrictedly, at least in terms of, going out in the fresh air. People can get COVID outside, particularly in mass gatherings. There was a football match in Scotland a couple of weeks ago where I think something like 60% of the people got COVID within a few days of attending that outside football match because, mass crowding. But in terms of the self-care aspect, as long as you're sort of, out and about trying to maintain distance as much as possible, or sort of working within the COVID guidance, the chances of contracting COVID, if it's not a mass gathering and you've been immunized twice, are very low, very low. So in terms of your socialization going forward, I would recommend that you do it more outside, and even though the government guidance is, go to all the concerts you want, I cannot recommend that. I think that's a terrible idea. I think that's a prime way to get COVID, whether you've been vaccinated or not. I think when the case rate begins to fall significantly and vaccination increases, then that might be a different story. But in the middle of a third wave, I'd keep it as much as possible to outside and as much as possible away from mass gatherings. So exercise can really boost your mental well-being. And obviously, it's the process by which we trigger endorphins. So obviously there's a feel-good chemical. So even if you're, sort of cooped up at home, working at home, if you go out for sort of, 20 minutes, half an hour, the NHS recommends about half an hour a day of light to moderate exercise, or about 2.5 hours a week. Then not only will be investing in your health, but it will make you feel better in most cases. Aromatherapy. Now, I'm not an expert in aromatherapy. Some people are. Some people study it, very rigorously, and there's all sorts of courses you can go and do, and I'd highly recommend that. It is slowly an emerging area of holistic therapy within kind of the medical model that we operate in. But do you know what? Like, honestly, I love candles. I spend a lot of money on candles. Yankee Candle, I won't name all the brands, but just having a wonderful scent can just completely shift your mood. Scents that are more energizing, scents that are more relaxing, help you sleep more. Obviously, don't fall asleep with a lit candle, but you know what I mean. There's some really amazing scents out there. Can be something you burn, like sage. Can be in sort of reed diffusers. Can be essential oil diffusers. Pick your. I don't want to say poison. Pick your measure, whichever you prefer. But that can really help. And people really underestimate it, like the impact of it on someone's mood. So have a think about that one if you don't really do that. Mindfulness. Now, I'm not sure if there's many, as everyone's heard of mindfulness. Mindfulness is obviously a meditation-based practice taken from Eastern meditation practices and philosophy. I certainly remember attending several mindfulness classes with Positive East, where a practitioner came in and talked to us. One really good app that you can get is the Headspace app, which often has a lot of sales and discounts on. In terms of pricing, I think the top price is £80 a year, but you can often get it for 40, 45. So not, depending on your budget, you might be able to afford that or not. There's a lot of free mindfulness guided meditations on YouTube. So if you just Google Headspace meditation or mindfulness meditation, you'll find a lot of them. But irrespective of whether you have the app or not, the NHS is seeing some really decent data on this in terms of, even before a pandemic, minimizing stress and anxiety and treating clinical anxiety and clinical level stress with mindfulness meditation. So 5 to 10 minutes a day, and it's really focused on basically keeping you grounded in the here and now and not living sort of worried about the future or obsessing over the past, which actually, given the sort of storm that we live in, that sometimes the wind blows hard and sometimes it's clear skies, it sort of fluctuates. Mindfulness meditation can be very helpful. I've certainly myself found it helpful, and I know a lot of my colleagues working in the NHS do it as well every day, and it's unbelievable. So I really recommend not to underestimate that. Hobbies. So, I mean, listen, I just think that any activity that you can do safely to socialize, the better. I mean, some of us are very extroverted, some of us have less of a social demand, but ultimately, they say no man is an island. And, this I think this year and a half has taught us that actually we to a greater or lesser extent probably need social interaction to keep well and to keep resilient and to keep going through this. So eventually when we do emerge fully from the pandemic, at some point in time, we have maintained friendships, we have built potentially more relationships. Hobbies can obviously be a wonderful way to do that. I myself have been running an online social group related to film watching. And we obviously do it all electronically, and I've made loads of friends even during the pandemic through that, and that's been really crucial. Now, studying, I put that because I know a lot of my colleagues and a lot of people I work with actually are still doing a lot of education. So that can be learning a new language, that can be learning how to cook something, that can be whatever class I talked about, aromatherapy, mindfulness, that can be doing a degree, a master's degree, whatever you want to do. And most of the people I talk to about that, find that it's really helpful to be working towards something that is building. So let's say learning a language, going from basic to intermediate, completing your next module in something, learning to cook in a certain way, having this sort of transition. Now, I know a lot of us during the pandemic have become 5-star Michelin chefs. I have not, unfortunately. But there's all sorts of things that you can do. There's a lot of free classes out there, and I know that Positive Ease can signpost you toward that. Having that takes time away from worrying about COVID, worrying about the future, if you are worrying about COVID. So I'd highly recommend that. And then this is not an exhaustive list. There's so many things that you can do. You probably already do a lot of them, but it's important to think about, how much value they're giving you. Sleep is vital. I don't care what anyone says, like there's so much evidence across so many different medical parts of the literature base saying that sleep essentially is a predictor of your quality of life and your length of life, as well as your mental function, as well as, if you have great amounts of sleep, it minimizes your risk for anxiety and depression and helps control those conditions better. If you have less sleep, obviously the inverse is true. So I'd really recommend, if you have any trouble sleeping, that you essentially Google sleep hygiene, and the NHS page for sleep hygiene has some really good tips about how to, which I hadn't thought of until I looked at it, to basically enhance your sleep environment and your pre-sleep environment, to kind of give you much better sleep. So a lot of these might sound obvious, but equally, when you delve into them, there's such an evidence base behind them, and they might be a lot more protective than you might have originally thought. So have a go. Moving on to the next slide, we're looking at the second part of protective factors. So this is society and services. So the first one was, what can you do? And this is now more looking at all the support around you. And this is really crucial, particularly, in the times that we have had lockdown, we might have felt socially isolated. It's important we understand we're not alone. There's so many services and there are people around us. And it's really important to keep that in mind. So I'm not sure if any of you have heard of an eco map. So an eco map, I didn't try and draw it because my artistic skill is that of a dead badger. But essentially an eco map is where you begin with a blank page, you draw a circle in the middle and you put me or whatever your name is, and then you as a hub, and then you draw spokes like off a bicycle wheel out from that circle, and you connect all your friends and family and your partners and whoever, even pets actually, within that social circle that are around you. And that is one way to visually represent in one clear way you know, these are all the people I have around me. I'm going to move on. I'm going to talk about that in a second, but I'm going to move on to the second aspect of that, just in the interest of time. So in terms of, we've talked about friends and family, but it's really important. And as a nurse, like, I just wish every single person in the UK did this. There are so many support services out there, run by the NHS, run by charities, run by local government, run by all sorts of organizations that are out there to support you, no matter, you know, what the health issue or the mental health issue that you're living with. I'd really recommend in your eco-map that you basically add, after you've done friends and family and, you know, dog, you add the professional people around you. So NHS counselling is available to you if you're having any kind of issues around the pandemic or your mental health. Your GP, just to let you know, about 55% of GP appointments are mental health related appointments, something I didn't know until I worked in general practice nursing. So there is no shame, there is no stigma, and there should never be any stigma about talking to your GP or anyone really about your mental health. So please, 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 if you don't have a good GP, change GP. Google, find NHS GP, put your postcode in, it'll come up with a bunch of hits. They'll have ratings, you can call them, make sure that they can take you on, find the one that's with a better rating for you. Because having a GP that you have a good relationship with is crucial for all your health, both in and outside of a pandemic. Your HIV team. So if you are living with HIV, obviously you have access to your specialist nurse, counselling, your consultant, really keeping in touch with your appointments, you know, keeping in touch with them and reaching out for support, not necessarily just waiting for the next appointment if you need it. That's what specialist nurses are there for, and they'd be happy to hear from you. NHS 111, give us a call, please do. So the NHS 111 service is there to talk about any physical or mental health issue. Ideally, people would call us with non-emergency issues. So obviously, if it's chest pain, stroke, you know, real feelings that they're about to, you know, end their life, you know, very emergency situations. Ideally, it's a 999 or A&E visit. However, you know, unsurprisingly, we do support people with all of those things as well. So NHS 111, we are the front door for COVID. So any concerns around COVID you can't find on the NHS website, call us. We're available 24/7 and it's a free service, and you can speak to a nurse or a paramedic, and we have our own out of hours GPs as well. So essentially, if you want to see your GP but can't, out of hours, so once the GP is closed, you know, after 6:30 and also on weekends, NHS 111 then has access to GP appointments with out of hours doctors. So, you know, if there's any concerns about there, you know, we're there for you, please call. Positive East, obviously, don't need to advertise that, you know, we're all here for this amazing charity. I mean, I've always been amazed at just how much good work they're doing, and all these lecture series that or workshop series that they're doing online is just fantastic. So, you know, thank you very much to them. Keep engaging. The charity's always here to support and signpost where need be. Most health conditions, so outside of, you know, Positive East, most health conditions that you're living with have specific charities and organizations that are there, often that run free and partial advice helplines and signpost you towards services. You know, they can often run sort of support groups, you know, informational websites, you name it. So whatever health condition you're worried about or living with, you know, if it's outside the remit of Positive East, there are many other there on top of the NHS that can help you. And it's important that you maybe put that in your eco map so you can see, if I'm in crisis, if I'm concerned, if I have an issue, these are all the people and services I can talk to. You might belong to a religious community. Obviously, if you do, you know, fellowship there, whatever your religious sort of organizational belief, you know, can be really important. And the same is true for local community groups of every kind, religious or otherwise. So sort of, you know, obviously engaging with them in as COVID safe a way as possible. The Citizens Advice Bureau is fantastic. I'm sure Positive East, you know, can signpost you there as well if there's any kind of practical concerns, money matters, that sort of thing, legal issues. And then the Samaritans. Samaritans, fantastic listening service. If there's any concerns, they're completely non-judgmental. You pick up the phone, you dial their number, and they're available 24 hours a day, 365 days a week. So looking at the eco map, you might be surprised to see like how much support you have around you, both in terms of seeing it visually with the family and friends, and also in terms of, you know, so many professionals around you. So if you're concerned around COVID, or if there's kind of an issue, reach out for help, please. This is so important. I think the other important thing to mention is the eco map is useful in that you can draw any relationships with a service provider, your GP, your brother, whoever it is. You can, if they're strained relationships and they're causing you stress, or you're not getting what you need out of them, you can draw the line instead of a single line. You can draw a broken line, and that can be quite a useful way to look at where the sort of the stresses are in your life, and you know what you're getting out of what you're putting in. So it could be, you know, a friendship that's no longer serving you. It could be the GP that needs changing. It could be that you want to change your HIV consultant, you know, whatever it is. As important as it is to see all that support around you, it's equally important to see if there's areas that are causing you to be stressed. Because if you can correct or remove those, you know, that's going to enhance your resilience to this pandemic even more as another service. So I think it's just important that you reflect how you feel about the support that you have on that eco map if you're going to do it. And if there's not enough, reach out for more to all these support services. You know, do COVID safe hobbies to make more friends and family, you know, well, friends rather, you know, and really kind of enhance your own support network. And I honestly, I preach this to all my patients at one-on-one, even before the pandemic. It's so important. And it will bear your health overall such an improvement to have this really watertight support network around you. And it's really important that you know it's okay to ask for help. So before we conclude, I'm going to go on to Mystic Meg moment. So the road ahead. So as I said, no one has a crystal ball. We can model for the pandemic, but obviously, things can happen, and it's hard to fully predict it with a high degree of certainty over the next, period of time, what's going to happen. What I would say in terms of the really positive factors that give me a lot of hope that this pandemic will shift to endemic, so away from a global issue that's happening all the time to a seasonal issue that's happening in certain regions and certain countries. For that shift to occur, I think the vaccine rollout is absolutely brilliant. I think the UK has done it brilliantly. I think the UK is, we've got such a high vaccination rate already, and it keeps going up and up and up. Perhaps not quite as fast as we'd like, but obviously we're looking at booster vaccinations already for the vulnerable and NHS workers, etc., in September. So that is such an amazing achievement. That is really, we've done it well, and we've done it better than a lot of countries. I would prefer that every country do it well, because frankly, until the world is vaccinated, COVID is still, variable to some degree. So that's a piece of good news. The second piece of good news is our testing capacity to actually get swabbed for COVID is excellent, as is our sequencing. So when we look at, what is the variant, the UK is literally the world's leader in genetic sequencing for COVID. So we're brilliant at identifying what the strain is. Even the US tests, I think, 10% of what we do. So, it's great to be in the UK for that perspective, but obviously other countries are slowly, gladly catching up, because it's important that we have that. But that's a really good thing to be confident in, that you can access the test if you need to, and that we can be aware of the variants as they're sort of emerging. The third really good piece of news, which is emerging over the next 4 months to a year, is more medications and treatments are coming out. So in the same way that we have PrEP, pre-exposure prophylaxis for HIV, and PEP, post-exposure prophylaxis for HIV, there's a lot of trials looking at doing the same for COVID to reduce the risk of getting COVID in the first place, even with the vaccine, and also, if you do get COVID, to nip it in the bud so you don't end up, deteriorating or having a longer illness. So those are coming out. They're coming out slower than vaccines because obviously less research money has been thrown than vaccines, but they will over the next few months and years emerge, and they will massively improve the situation as well. I think the most important thing is just to recognize that you've got through this. You should be so proud of yourself. You've got this far, you know. I don't know anyone who 18 months ago thought that we would be living through these sorts of times. This is a generational, worldwide generational shift. So, you know, just pat yourself on the back. You deserve to recognize that you have been resilient enough so far to get through this. And you can absolutely get through the rest of the pandemic as it sort of goes up and down. So, road ahead continued. These are the unknown factors. So obviously, you know, we talked about the Alpha variant, the Delta variant, these sorts of things. There's now a Lambda variant and a Delta Plus variant. Variants, basically, the more the virus transmits, the more it mutates. The more it mutates, at the moment, the more virulent it's becoming. So the more lethal it's becoming, the more kind of easy to transmit it's becoming. Obviously, we have vaccines, but our vaccine efficacy will slowly be eroded until we have booster vaccines, which are happily coming in September, which will boost that right back up. But it's unknown. You know, ideally the variants become less lethal, right, or rather less transmissible. Right now, that's not the case. So, you know, it's unknown where that's going to go. When COVID, we don't know exactly when COVID will shift from pandemic, as I said, to endemic state. You know, that's a real sort of question mark. And there's so many factors to that, because it's not just how well the UK does on that, it's when the UK opens its borders, how well other countries have done, and vice versa. Already the UK's, you know, unfortunately exported the Kent variant, the Alpha variant, across the world. So, you know, that's a real movable feast. It's very difficult to predict that. And then lastly, just when will COVID mutate to become less lethal and less transmissible? So HIV obviously is very, very, very well managed with antiretroviral therapy medication now. However, the actual HIV virus in circulation in many parts of the world is now a lot less virulent, less lethal itself than the virus was back in, you know, when it first emerged in the 1980s and then into the 90s. And we know that a lot of viruses do tend to eventually mutate after enough transmission has occurred to essentially become less lethal. So that is not going in the right direction at the moment, even though vaccines are protecting us. The virus is still quite, you know, fighting sort of like a two-ring fight at the moment with that. So we don't know when that's going to happen. That could be a year, that could be 10 years, who knows? But, you know, research will provide the answer on that. The most important lesson, this is a real takeaway, is, you know, the COVID pandemic is so variable. Christopher Whitty, the chief medical officer, I'm sure we've all seen on TV, has said with COVID, you know, things can come out of a blue sky. So things can be going great and then suddenly, you know, something happens. An example of which is in Holland 3 weeks ago, the COVID case rate was quite low. They've unlocked everything and now they're having to go back into lockdown after 3 weeks. This is one of the reasons why I'm concerned about the government abandoning all hope of controlling the virus with no restrictions when we're in the middle of the third wave. But, you know, let's see, we shall see. The most important thing I really want people to sort of understand is most people are holding on to this notion of when will normal happen? When will normal be restored? You know, the government are keen on pressing with their sort of irreversible progress model, which is not very compatible with how science or medicine works. But there is no simple answer to when will normal be restored. What is a better sort of question is, how long can we have relative return to normality? For how long? So in my experience, you know, I think we have waves and then we have peaks. We have waves and we have peaks. Hopefully, as science and technology and vaccination emerges and, you know, across the world, we'll have less and less months where it's high and more months where we need hardly any restrictions, if any. But again, that's not entirely predictable, and I'm happy to answer questions on that later. The idea that we should hold on to sort of normal being around the corner itself can bring hope, but it can also bring anxiety. You know, and this is when looking back at mindfulness meditation and recognizing and accepting the situation we're in. We're in a global pandemic, you know. It will end, whether that's a few months away, whether that's a few years away. It's very difficult for anyone to call. So maybe the better question is just, how can I enjoy and keep safe day to day and live my life and invest in my life, invest in my friends, invest in, you know, being healthy and keeping resilient and strong, rather than what's the precise date a politician decides it's all over, you know, because that's, you know, I think that for me to end this, you know, and I appreciate I've been talking for quite some time, so I'm keen to hear from you guys, but in my view, like the most important lesson to be learned with all these COVID resilient strategies is to enjoy the sun when it shines, lean into the storm when clouds arrive, and learn to dance in the rain. So with that, we'll conclude. Obviously, we've discussed the road so far, vaccinations, common feelings around the pandemic, all very different feelings in relation to 3 different case studies, investing in protective factors through self-care and in terms of the support services and wider social network around you. We've briefly discussed the road ahead and that it's quite fluctuating, who knows. So there we go. Thank you very much for listening. Stay safe, reach out to support anytime you need it. And remember, you are more resilient than you've ever thought. Well done.